I am going to demonstrate a manual blood pressure for you. So you may have learned how to do a manual blood pressure in the past, but here at Deltec we would like for you to do a two-step blood pressure. It's more accurate and it's going to cause less discomfort for your patient. So first I'm going to do my wipes. So of course I've washed my hands, and I'm going to introduce myself now after knocking. And this is my husband. He's agreed to be in this video for us. Hi, Mr. Taylor. I'm Jenny. I'm going to be your student nursing assistant today. Is it okay if I get your blood pressure?
Yes.
Okay. So I've explained the procedure, so I'm going to provide privacy. And I'm going to make sure that he's safe. If he's in a wheelchair, the wheelchair is locked. I want to make sure that he's sitting upright with feet flat on the floor, that his legs are not crossed. And I want to tell him not to talk during the procedure. So if you don't mind while I'm doing this, just don't talk, okay?
Okay.
Because if you're speaking, then it raises your blood pressure a little bit. So you can go ahead and place your arm here for me. You want the arm to be level with the heart as much as possible. That's going to give you a more accurate reading. The very first thing that we're going to do is get a brachial pulse. Okay, so if you don't know how to do that, you need to start practicing that. It's a little bit more difficult than getting a radial pulse. So to do that, I'm just going to place my fingers on the inside of his upper arm. You got a really strong pulse. Wow.
Thank you.
So if you can't find it, you need to go to the antecubital space, which is right here. Go towards the inner side of the arm, and then sometimes you have to push that bicep out of the way a little bit. So it's about right there. So once I've located that, I'm going to get my sphygmomanometer. That's your blood pressure cuff. Every cuff has an artery marker on it, so you just need to figure out where that is. So this is your artery marker. And I'm going to place that, guess where? Just right on top of the brachial artery. So located that, I'm going to place it right on top of there. Okay, you want to make sure that it's high enough so that it's not way down here. When they bend their arm, it's going to interfere with your blood pressure. You also want to make sure that you have the correct size cuff for your patient or your resident. There's an index here, and if you can see, the index needs to be inside of this range. If it's outside of the range, your cuff is either too small, which is going to give you an inaccurate high reading, or it's too large, which is going to give you an inaccurate low reading. So this is the right size cuff for him. This is an adult large. He has a big arm. Most people, medium or a regular will fit for them. This is removable. If it's difficult for you to see it way over here, you can move it, and I usually just like to hold it. So our first step in the two-step blood pressure is going to be to figure out where we need to pump this cuff up to, okay? So I'm going to find his radial pulse, which is right under that thumb, in between the radial bone and the tendons. So it's right there. Got a good radial pulse too. And then I'm slowly going to pump up while I'm feeling that pulse. I'm going to continue to pump until I don't feel the pulse anymore. So for him, it disappeared right around 140. So then I'm going to release. Okay. Give him a second to, get back to normal. So the number where I felt it disappear was 140. I'm going to add 30 to that number to get 170. And that's what I'm going to pump up to when I'm taking the blood pressure. So this is the part where you get your stethoscope. You want to make sure the binaurals are turned inward facing your nose, okay? And then just check it to make sure that it's turned towards the diaphragm, which it is. So when you tap on it, you should hear it. If you can't hear it, you might need to turn it. These do turn, okay? But we're going to use the diaphragm, the bigger side. And I'm going to place that right on top of that brachial artery where I found it earlier, right here. Okay? And I'm going to pump up to 170. Once I get to 170, I'm going to slowly release, and I want every second to be about 2 of the little markers. Every one of those little markers is about 2 millimeters of mercury. So it goes up by 2. So it's very difficult to get an even or an odd number with this. So with a manual blood pressure, you're always going to get an even number. I'm going to do that again because I was talking and I couldn't hear. So, get to 170. got about 132/70, probably because I'm stressing him out right now. The very first sound that you hear, it sounds like a heartbeat, is going to be your systolic blood pressure. The last sound you hear is your diastolic blood pressure. And there's a series of sounds in between. The sound changes. Those are called the Korotkoff sounds. So there's another video that you guys will watch to learn more about the Korotkoff sounds. So it takes a lot of practice to get this right. So make sure that you practice on, friends and family if they'll let you. And don't get discouraged if it takes you a while. This is the hardest skill that you'll learn in this class. All right, so if you have any questions, let me know. Thank you.